911 emergency.
Imagine a disaster in your town. Are you prepared? A major incident, a hurricane like Katrina, an infectious outbreak such as smallpox or the avian flu, a terrorist attack with a nerve agent like the Tokyo subway bombing. What do we do in an incident when we have multiple patients that need aggressive respiratory management? We need to be prepared for the next disaster by stockpiling an affordable solution, a device that can be used with personal protective equipment. Easy to use. That can proceed through decontamination with the patient. And that works. The answer is here. A device that will save lives and truly make a difference when disaster strikes. In the next few minutes, you will experience the automatic resuscitator. It is gas-powered, pressure cycled, and allows for hands-free operation for breathing and apneic patients 10 kilograms and above. Disposable, cost-effective, and can be stockpiled ready to be rapidly deployed in a disaster. Here's how it works. The automatic resuscitator is a disposable device that provides consistent hands-free, constant flow, pressure-cycled ventilation and is easy to set up and use. The patient T of the automatic resuscitator consists of a patient connection port for connecting to a mask or endotracheal tube, a redundant pop-off valve which activates at 60 centimeters of water pressure, an air entrainment valve which allows the patient to entrain ambient air when desired, and a gas inlet for connecting to an adjustable 50 psig gas source such as a flow meter or oxygen flow regulator. The automatic resuscitator is completely gas-driven, requiring no electrical power, and will deliver 100% oxygen to a patient when supplied. It also has a gas entrainment option for delivering FiO2 at either 50 or 100%. If 100% is desired, connect one end of the supply tubing to the gas source and the other end to the green-colored DISS connection marked 100%. Then set the desired flow. The operating flow range is adjustable from 50 to 40 liters per minute. The flow is self-limiting to 40 liters per minute when connected to a 50 psig source. If 50% FiO2 is desired, remove the green 100% adapter and connect the supply tubing to the gray-colored entrainment adapter on the patient T. Set the oxygen supply flow from 6 to 15 liters per minute. By entraining room air, the patient will receive flows up to 40 liters per minute, significantly reducing the rate of oxygen consumption. The automatic resuscitator is suitable for patients weighing 10 kilograms and above. The modulator has two dials, which control pressure and rate. The pressure dial provides a range of 10 to 50 centimeters of water pressure. This sets the patient's peak inspiratory pressure, or PIP. Some models provide a PIP range of 20 to 50 centimeters of water pressure. The pediatric automatic resuscitator provides a PIP range from 10 to 45 centimeters. The rate dial functions like an adjustable expiratory resistor, controlling the patient's exhalation time. Turning the rate dial inward or clockwise increases the exhalation time. This slows down the patient's breathing rate. Turning the rate dial outward or counterclockwise decreases the exhalation time. This speeds up the patient's breathing rate. There are 5 easy steps for setting up the resuscitator. 1. Connect tubing and set the flow rate. 2. Set the pressure. 3. Check the function and connect the patient. 4. Set the rate. And finally, 5. Readjust the setting to meet the patient's needs. First step, connect the supply tubing to either an appropriate cylinder or wall source. The automatic resuscitator is designed to automatically deliver 40 liters per minute when connected directly to a 50 psig gas source. For better flow control, a flow meter capable of 40 liters per minute is preferred. The flow controls the inspiratory time. The higher the flow, the shorter the I time. The lower the flow, the longer the I time. It can deliver oxygen in the 15 to 40 liters per minute range to operate the automatic resuscitator for patients requiring 100% FiO2. It will also supply oxygen in the range of 4 to 15 liters per minute to operate the automatic resuscitator in the entrainment mode, delivering 50% FiO2 by entraining room air. The second step in setting up the resuscitator is to set the patient's peak inspiratory pressure, or PIP. Adjust the pressure dial to the desired setting. Positive end expiratory pressure, or PEEP, is intrinsic to the automatic resuscitator. The PEEP ranges from 2 to 9 centimeters and is directly proportional to the set PIP. Once your flow and pressure have been set, perform a function check on the unit before connecting it to the patient. This is accomplished by occluding the patient connection port and verifying that the modulator opens and the pressure does not exceed 60 centimeters. It is recommended that the automatic resuscitator be used with a pressure manometer. You may use the manometer provided or a manometer of your choice. The PIP indications on the pressure dial label are approximations only. Once you have performed the function check, connect the automatic resuscitator to the patient. Ventilatory support will begin immediately. To connect the automatic resuscitator to a patient with an endotracheal tube, simply attach the patient connection port to the tube. Because of the reliability of an ET tube and airway management, this is the preferred method of connecting the patient. The automatic resuscitator may also be connected using an appropriate CPR mask. It is very important to be thoroughly trained in the correct use of the mask before attempting to use one with it. Step 3. Adjust the rate dial to the desired rate. This may only be accomplished after the patient is connected to the automatic resuscitator. To slow down the patient's breathing rate, turn the rate dial clockwise. For a faster rate, turn the rate dial counterclockwise. For a non-breathing patient, set the automatic resuscitator in the pressure control mode, which provides automatic cycling. Adjust the rate dial to the desired rate and count off the breathing rate manually. If the resuscitator does not cycle, back out the rate dial until the device starts cycling again. If the patient is breathing spontaneously but needs support, put the resuscitator in the pressure support mode, in which the patient triggers a breath. This is accomplished by adjusting the rate dial clockwise just until the resuscitator stops cycling automatically. Be sure to monitor the patient's effort with a manometer. Because the automatic resuscitator has no monitoring functions, it is imperative that a clinician be present at all times. Observe the patient to ensure proper ventilation and do not leave the patient unattended. In case of vomitus or severe patient secretions, first disconnect the modulator from the patient T and allow the gas flow to push the secretions out. Next, tap the modulator on a hard surface to clear and then reconnect it. If the modulator jams or malfunctions, the resuscitator is equipped with a redundant pressure pop-off valve which will activate at 60 centimeters. In the unlikely event that it malfunctions or fails to deliver support, or if the pop-off valve activates, discard the device immediately and provide another means of ventilation. If the patient's airway path from the resuscitator becomes occluded during normal operation, the device will start to cycle rapidly. Clear the pathway so that the patient will receive effective ventilation. Because the resuscitator is pressure cycled, changes in the patient's lung compliance will cause a change in the patient's breathing rate. In such an event, make the appropriate clinical changes. Significant leaks within the circuit will cause the rate to slow down or stop. In review, follow the step-by-step guide for setup. Step 1. Set the flow to approximately 25 liters per minute with a flow meter from a suitable gas source. Step 2. Set the PIP with the pressure dial. Each resuscitator is factory tested and preset to 25 centimeters of water pressure. Step 3. Before connecting to the patient, perform a function check. Connect to the patient and then verify PIP with a pressure manometer. Step 4. Adjust breathing rate with the rate dial. Remember to slow down the patient's breathing rate, turn the rate dial clockwise. And for a faster rate, turn the rate dial counterclockwise. And finally, Step 5. Readjust flow, PIP, and rate for the patient's clinical situation. And remember, there is no substitute for good clinical assessment. The automatic gas-powered resuscitator is a safe, effective, and reliable means of short-term ventilatory support. We hope this video has provided you with a clear understanding of its safe and effective operation. A disaster will eventually happen in a town close to you. Will you be ready?